Good afternoon, everyone. Thank you for joining us today for our Cancer and Mental Health webinar. Um, we have several wonderful speakers today for you. I am Linda Casbeyer with the Illinois Department of Public Health. I'm the Comprehensive Cancer Control Program Manager. And sorry, my screen went blank there for a minute. Okay. So our co-hosts for this session um, and the planners for the session are Dr. Keith Naylor and then also Dr. Neil Porelman, who might be joining us later. So they will be the hosts. They're also the co-chairs for the Illinois Cancer Partnership Screening and Early Detection Committee. So thank you for joining us. And Dr. Naylor, we will turn it over to you.
Thank you, Linda. We have a host of very accomplished panelists today, but I'll keep my introductions very brief. So our first speaker will be Dr. Araba Kofi. She's a licensed clinical health psychologist. She works with patients presenting with a range of concerns such as depression, anxiety, trauma-related concerns, women's health issues, and comorbid physical and mental health conditions. Dr. Kofi's presentation will be on the impact of cancer on mental health. Thank you very much.
Hello, I'm guessing I can start now?
Yes, and Elise, you can go ahead and start the slides.
Thank you so much. Hello, everyone. Good afternoon. Thank you guys for having me today. So as mentioned, my name is Araba Kofi. I'm a licensed clinical health psychologist, and I will be speaking today about the impact of cancer on mental health. So a lot of my experience with cancer comes from my training experiences and practice in across hospital settings, specifically in cancer centers, rehabs, and ICUs. So I hope to share with you some of what I've learned about the impact of cancer on mental health from these experiences and also learn from others here. Can we please go to the next slide? So it doesn't come as a surprise to many of us that learning to live with cancer presents one of the biggest challenges ever faced, because cancer touches just about every part of the patient's life, right? And the lives of those around them. It takes a toll on the physical, emotional, social, and financial domains of the person's life. And so, like other chronic illnesses, cancer and its treatment may change daily routines, ability to work, important relationships, the way the person feels, looks, or thinks about themselves. Next slide, please. So given this, the stress that comes with the cancer diagnosis and treatment can be very overwhelming. Because of that, it's not uncommon for patients to experience chronic stress, periods of sadness, frustration, anger, and nervousness. So this can be a pretty normal response to such a life-altering event. However, this response, when it becomes excessive, persistent, and impairing, can become a clinically diagnosable mental health condition. With literature, we've noticed that there is cancer patients have an increased risk for mental health disorders, particularly even for those without previous psych history. We've seen high rates of depression, anxiety, adjustment disorders, cancer-related post-traumatic stress or PTSD or other trauma-related disorders. In fact, the National Cancer Institute purported that about 1 in 3 cancer patients experience a mental health problem during or after treatment. About 50%, so half of patients, will experience anxiety or depression. Okay, and so, for example, with the rates of depression, we've seen a prevalence of about 3 times higher than the general population. Depression may present as sadness, feelings of hopelessness, anticipatory grief, anhedonia or loss of interest in things that were previously interesting or pleasurable, fatigue, appetite changes, hopelessness, sense of guilt, and kind of a complete immersion or consumption in the identity as a cancer patient. Anxiety can be characterized by excessive worry about the cancer diagnosis, the treatments that it may entail, feelings of loss of control, uncertainty surrounding mortality, death, and that can all impact sleep. And poor sleep can then exacerbate physical ailments as well. With literature, we also know that the experience of cancer can exacerbate those who already had pre-existing mental health conditions. There are also certain cancers that we've noticed have a higher risk for mental health prevalence for mental health outcomes. So cancers such as breast cancer, head and neck cancer, pancreatic cancer, a lot of the cancers that present with higher severity, poor prognosis, poor quality of life. So with what we've noticed about the prevalence of mental health conditions among this population, we've noticed that this results in negative implications for the cancer trajectory and for the treatment, for the recovery, and for the overall quality of life. This could happen through reduced health-seeking behaviors, reduction in adherence to treatment recommendations, reduced screening behaviors, and others. There is a positive note, though. We've also noticed with literature that interventions to decrease psychological distress can have beneficial outcomes for the cancer trajectory and overall quality of life. Next slide, please. I did place in here quickly, due to time, I'm not going to go over this, but I did want to kind of highlight some of the factors that may predispose an individual to mental health conditions such as depression and anxiety. So that is characteristics of cancer, individual characteristics such as age, gender, comorbid health conditions, cancer treatment, and specifically, for example, there are certain types of treatments that can induce inflammatory processes that can actually impact or it results in dopaminergic suppression, which can predispose individuals to depression. I think in literature, we've also seen that there are certain steroids that have been implicated in the development of depression. So all of these things are just kind of here so that we can keep that in the back of the mind of some of the risk factors to kind of look out for. Another one I wanted to mention is also the sense of stigma surrounding mental illness and a type of cancer can result in feelings of shame or guilt that can also predispose individuals to clinically diagnosable mental health conditions. Next slide, please. So given the prevalence of mental health conditions among this population, it is common for many experiencing cancer and facing mortality or illnesses with significant morbidity to think about death and to have transient thoughts of wanting an escape from the discomfort, for the pain, from the uncertainty, or transient thoughts of maybe X would be better off without me, or maybe I don't want to put this person through this. These can be normal thoughts to have. However, when these thoughts become persistent, they can then lead to active suicidal ideation with intent and plan. And so we've found in literature that cancer patients present with higher risk for suicide than the general population with sometimes twice as likely to die from suicide. And this has been shown particularly within the first few months of diagnosis, particularly within the first 6 months. Rates have been also as high as about 7 times as likely. And this is often associated with several risk factors, psychosocial and general and cancer-specific risk factors, such as hopelessness, learned helplessness. So this is kind of a state that occurs when a person has experienced a stressful situation repeatedly, and they believe that they're unable to have control or have limited control in changing the situation. They develop kind of the sense of helplessness that can perpetuate depressive symptoms. Perceived burden on others, loss of independence, limited support, experience of chronic pain, and poor quality of life. Some of the general cancer-specific predictors, which we'll also kind of have a slide for a little bit later, are gender, age, cancer type, and prognosis. One thing I want to highlight here in the slide is that for those who do commit suicide, it typically happens within the first year of diagnosis. So this emphasizes the importance of early screening and intervention for the cancer care and throughout the cancer care continuum. So this may require clinicians to have astute observation of the changes that can occur with cognition. So for example, this may present as reduction in future-oriented language or speech, in emotional disruptions, so depressed mood, blunt affect, flat affect, behaviors such as disengagement from treatment recommendations, suggestions by physicians, social support systems. Next slide, please. So as I mentioned earlier, I put in here the slide, not to go over it because of time constraints, but I did want this to be available so that we can easily kind of pinpoint some of the risk factors that are general and cancer specific, and also note some of the protective factors that can help abate the risk for suicide. I think one thing that's important here is normalizing conversations about suicide, normalizing conversations about death can be a first approach to addressing this concern. Next slide, please. You know, and as I mentioned earlier, cancer rarely impacts just the patient. Caregivers can also experience similar psychosocial burden of cancer, and therefore they're also susceptible to mental health conditions such as depression, anxiety, PTSD, adjustment disorders. And for those that are not experiencing clinically diagnosable mental illness, they can experience excessive stress and burnout, which can impact the type and degree to which they're providing support for the patient, which can, as we know, be detrimental for the patient's cancer trajectory. So having support groups available, and I put a quick link for where to identify such support groups, having avenues for caregivers and support system to obtain individual supportive counseling for themselves, and providing other helpful tips to manage burnout, such as finding time to relax, keeping up with personal life, because we know that for caregivers, personal life tends to be cut out during this time, but trying to maintain as much of it as possible, trying to maintain as much of a routine as possible, given disruptions, routines that will occur from frequent hospital visits and attending other cancer-related services. Also asking for help, right? Helpers need help too. We all need help. And so asking for help to help the caregivers maintain some sense of normalcy, some sense of balance in their life as well. And as always, taking care of the body, whether this is through exercise, going for walks, yoga, whatever that may be, to help maintain that sense of balance for that caregiver so that they can be in the best position to care for the patient. Next slide, please. I wanted to, along with this talk, provide recommendations for providers and the healthcare team. People are living longer with cancer, right, due to advancements in treatment and technology. And so this has caused a paradigm shift for cancer care. There's a shift for more integrative approach to care to provide a more holistic kind of view of the patient's treatment. So this may entail interdisciplinary collaboration. And one thing I want to actually highlight here is that collaborative care has been found to be the most effective type of care for cancer. So this could entail working and collaborating with psychologists, palliative services, social work, chaplain services, In some of the settings that I have worked in, I've even noticed acupuncturists, massage therapists, all kind of working together to provide a holistic type of care for the patient. And, you know, with the data that we have on the prevalence of mental illness among this population, there is still little attention given to the treatment of mental health conditions in favor of treating the physical ailment or physical symptoms of cancer. And in a sense, that makes sense, right? However, and even patients often prefer this. But what we know is that delaying treatment for mental health conditions can have a detrimental impact for the cancer journey. So we know that you can treat both the cancer and the mental health condition at the same time. There is no need to postpone or delay. So this may present as an area for psychoeducation for patients and sometimes even for providers as well. So treatment may entail assessment, early interventions, normalizing conversations about suicidal ideation, desire for hastened death, topics about death, providing trauma-informed care in practice. This is especially vital for patients who are experiencing cancer-related post-traumatic stress or PTSD, and this can look like modifying the delivery of treatment or screening services in a way to ease anxiety, to increase comfort, to increase adherence. Another main point here for providers is to provide a lot of transparency when working with patients. Transparency in communication of diagnoses, prognoses, treatment trajectories, treatment plans. And this is to the extent that it's possible, right? Because there are some cancers that there's just a lot of uncertainty about of what the outcome may be, and that may hold providers from or prevent them from sharing too much. However, we know that patients prefer to know rather than to not know, just because it can help to ease some of that anxiety. Another point here is for providers to incorporate patients' values when incorporating patient in decision making. This can help to provide a sense of control in an otherwise situation that patients tend to have very limited control in. And then, as I mentioned, attending to the needs of the caregivers, the families, the support systems, by providing resources for support for them. And then also knowing that not everyone who is distressed about their cancer or their circumstance is clinically depressed or experiencing a clinically diagnosable mental health condition. Being distressed about this life-altering event is appropriate. And so some patients are just responding appropriately. So this just means keeping up with routine assessments to figure out when the appropriate response has shifted into maybe a more maladaptive one. Encouraging strengths, coping skills of those who are coping normally or coping or responding in a way that is quite normal, and bolstering the repertoire of coping skills of these individuals. Next slide, please. I also wanted to kind of talk a little bit about some of the mental health interventions that psychologists use in this setting. We may provide space for improvement in problem-solving strategies. We may provide space for processing anticipatory grief, fear, anger, and other complex emotions. CBT is a treatment modality that is often used in the setting, particularly for insomnia, right? So the sleep disturbance that can come about. So CBTI, CBT for chronic pain, to manage pain that is often associated with the diagnosis, the treatments, and also other behavioral pain management techniques. There's also relaxation techniques, mindfulness-based interventions, and in fact, mindfulness-based interventions have been found to be very efficacious for improving quality of life of patients with cancer. trauma counseling for those presenting with post-traumatic stress, cancer-related post-traumatic stress, and acceptance and commitment therapy for patients that are struggling to adjust or having a difficult time adjusting to some of the uncontrollable aspects of cancer. In some situations, I want to mention that medications may be beneficial, but I did put an asterisk here just for a caveat that there may be some drug interactions with some antidepressants. So that needs to be attended to. And some medications may be contraindicated for certain types of cancers and symptomatology. We may also refer to support groups because this can be really beneficial for improving sources of emotional support, providing a sense of camaraderie, and learning from others who have walked this path and what has worked for them, what has not worked for them. Next slide, please. I also wanted to touch just a little bit on the gaps in research when it comes to this topic. We do have a lot of data, but there's still some dearth that needs to be addressed. We need to look a little bit more about other types of mental illness and the correlation with cancer, because there is a heavy focus on depression and anxiety because they tend to be the most common ones. But maybe looking at other mental health conditions of dementia, right? And because of the cognitive impairment that can happen. And also looking at the impact on caregivers and support systems a little bit more so we can better understand what are some of the more effective recommendations for their care, examining barriers to obtaining mental health care for this population a little bit further, attending to other types of cancers. We tend to look more at the more common cancers like breast cancer, so looking at some of the rare ones, although this may present with a bit of difficulty because some of the rare ones, it's hard to get a sample size, but this is where case studies may be beneficial. And also looking at types of supports that are needed for patients because this can vary. And so this presents with a need for personalized approach for support and treatment, and how this can be accomplished given limited, given time constraints and limited funding. Next slide, please. So as we come to the end of this talk, if there's any takeaway, I would hope it would be that mental health disorders or conditions are treatable even in the context of chronic illnesses. And we really should not delay or postpone care for that, because doing so may have detrimental effects on the entire illness trajectory. Next slide, I just put a few resources here for those who may want more resources for patients and providers. And other side, I just put some of my references should you want to do a deeper dive in some of these readings. And just wanted to thank everybody for their time and for allowing me to share some of what I've learned on my journey.
Thank you so much, Dr. Kofi. That was wonderful. I believe we have just a few minutes for questions. If there are questions from the attendees, you can put them in the chat. While we wait, I was wondering, when it comes to someone with a cancer diagnosis, oftentimes they're also dealing with having to go to the doctor more frequently for treatments and other things. It may be difficult for them to actually be able to present to the office for mental health care initially. You mentioned some of the sort of non-medication related treatments. When people are waiting for their first visit to meet their mental health specialist, or they're looking for resources, are there things that you could recommend as sort of a trusted first step that they might be able to do even before they're able to meet someone like yourself or other mental health providers?
Yeah, excellent. So, as I mentioned, a lot of settings have now become a lot more integrative. And so they have psych-onc available on call to even kind of pop into the room after the physician's visit or after the oncologist visit as kind of a way of a warm handoff, to establish that access to the care. So that is some of the first steps that I have noticed. In our work, we also provided brochures with tips to manage and cope with the distress during this time. And other resources that are sometimes online can also be first steps before getting access to care. Because I recognize what you're saying is that sometimes access to mental health services can be really difficult, and particularly more so for populations experiencing chronic illness.
Well, thank you so much. And if there are questions that we weren't able to reach on the chat, we can try to come back to them at the end of the presentations. But thank you so much, Dr. Kofi. We'll move on to our second speaker. So Dr. Deborah Manst is an onco-generalist at the University of Illinois Cancer Center. She manages the survivorship clinic at the Miles Square Health Center, which oversees the care of approximately 200 cancer survivors. And Dr. Manst will be presenting on mental health and cancer survivors. Thank you very much, Dr. Manst.
Thank you, Dr. Neeler, so much. And thanks, Dr. Kofi, for that talk. That's so much of what I kind of wanted to talk about. I thought we should compare notes because all those things that you talked about are so important in the mental health of cancer survivors. So I want to offer just kind of a little bit of another side of this from a physician's perspective in the clinic. And as next slide, please. As Dr. Neeler said, I am an onco-generalist, so I know kind of enough oncology to keep survivors on track with all their follow-up and what they need longer term after cancer treatment. But I also am a generalist and help them with primary care issues and mental health care issues all the time. So I'm also a previvor, so I'm very close to this. Like Dr. Kofi said, almost everyone knows someone and is affected by cancer. My sister had cancer when she was young, and I found out I have a cancer gene. So I'm very close to this topic, and that's why I'm in my chosen area. Next slide, please. So my talk today, I'll talk about the importance of mental health, and then in cancer survivors, review common mental health issues. Not too much. I know Dr. Kofi covered that very well, but I want to explore from our side what we do, what we talk to patients about, how we approach them in terms of strategies that can help them cope and manage with these issues that they have going on. And then finally, I just want to touch on some current developments in the area of mental health for cancer survivors. Next slide. So cancer survivors, not everyone knows this. The NIH defined it in the 2006 paper, saying an individual is considered a cancer survivor from the time of diagnosis, during and immediately after treatment, throughout the balance of their life, which is not something that a lot of people think about. They think about survivorship as the time of after treatment, when a cancer survivor like re-enters the world, right? But I'll tell you why this is so. Next slide, please. Imagine sitting down with your doctor and getting a diagnosis of cancer. All of those questions rush into your head. You have so many emotions. You're experiencing everything that we're talking about, all the emotions of grief, of uncertainty, and what do I do? What doctor do I see? So survivorship starts there. And that's when we engage to help these patients cope with everything, because there are so many needs these survivors need. Next slide. And the survivor population is growing exponentially. 1.2 million new cases of cancer every year. And every 30 seconds, a new patient is diagnosed with cancer. So this is a very enlarging population. Next slide. This is a very well-known graph of the trend of cancer survivors. And by 2040, we should have 26 million, because we're better at treating cancer and we're better at keeping patients around even when they have late stage cancers. Next slide, please. So and all these survivors, with having so many of them, and they all experience, not go through each of these, but a myriad of side effects, right? just things that cancer treatment can bring on, both psychosocial, physical. And next slide, please. So it's important because these symptoms can persist long term, start during cancer treatment and keep going, or come up 5, 10 years later. And this all is very distressing. It's very disorienting to cancer survivors. So supporting mental health, especially in this population of patients, is vital to taking care of them. Next slide. So like Dr. Kofi said, there's this interplay of all of these psychosocial issues, and I won't go over all of this picture here, but it's all the dimensions of caring for a cancer survivor. The spiritual, social, physical, and psychological all play within one another. Next slide. And Dr. Kofi did talk about and tackle a whole lot of these. And I think, no offense, Dr. Kofi, these are underestimates that you provided of the number of patients who have anxiety, who have distress, who are depressed. They go through grief, that their life has completely changed. They've lost their old life. They don't know what to do with this new identity that they're taking on as a cancer survivor, or scanxiety, we like to call it. Is patients regularly get imaging tests to make sure you have no cancer around, and that causes a lot of feelings. Cognitive impairment, the chemo brain, right? The memory lapses, and can be very distressing for patients. Fear of recurrence, I think, probably affects most cancer survivors, 80% plus. This is just worrying and worrying that a cancer is going to come back. Then patients, more specifically, some get post-traumatic stress symptoms like hypervigilance or body image issues if they underwent a disfiguring surgery. Social isolation can occur because survivors may feel like they're not really well understood, or they're kind of on their own, and all of this just is exhausting, right? So what's exhausting is all these things, but then next slide, you are compounding it with all these other things, physical issues like pain, nausea, constipation, fatigue, and insomnia. Poor sleep is no one's friend and really can affect how negative you can be about things. They undergo nutritional difficulties, financial stress like insurance issues, the cost and the burden of cancer treatment, and maybe they're seeking unemployment or disability, or they have a weakness, low activity or exercise because of that weakness, and this leads to disability. And these patients, again, that change of identity into a survivor that's now disabled is very tough. Relationships can become strained and can become broken by going through this type of treatment. Next slide. So it's important for patients to build a support network. And this is something that we clinically in the clinic, in the survivorship clinic at UIC, help patients to build a team that's going to support them. Because there's associations with decreased cancer mortality. A meta-analysis from in 2020 looked at 87 studies on perceived social support, network size, and marital status with survival of cancer. And they found that having high levels of perceived social support, larger social network, and being married were associated with decreases in relative risk for mortality of 25, 20, and 12% respectively. So it definitely makes an impact to have a team behind you, even if you feel alone. Next slide. So we help these patients to recognize, there are people, friends, pets you can lean on, healthcare professionals, and building the team, having different doctors, different specialists, oncology, primary care. Nurses and navigators can be very supportive and helpful. And having this open communication just helps so much to build that trust between patients and providers. And then the mental health services, counselors like psychologists, psychiatrists, social workers, and wellness practitioners. And as Dr. Kufi said, CBT, stress reduction, and coping skills is really kind of what we want to build. Next slide. So also touching on something that's been said is support groups can be very beneficial. Connecting with other survivors who have a shared experience, maybe locally or online. And community organizations are great and offer so many supportive services like mentorship, which we'll hear about later, support groups, exercise programs, transportation services, anything to help to break down those barriers to get quality cancer care. Next slide. So I just wanted to bring up a few of them. We'll hear later from one of these organizations, I understand, and but all ready to provide support to cancer survivors along their journey in different ways. Next slide. So building those coping strategies, like I said, and enhancing patients' resilience and empowering them to manage their own health, is that they actually have an opportunity in reframing the whole journey as they can build and embrace their own new normal, as we call it. Enhancing self-management skills by engaging survivors to be more active and involved in their own care actually results in an increase in the ability of survivors to manage. So there is literature on this. This is just the tip of the iceberg, just came out. Next slide. And as again stated before, the impact of mindfulness-based stress reduction, large proponent here of integrative medical therapies, actually pulled together 17 studies on these programs and quality of life. And mind-body stress reduction programs significantly relieved cancer-related fatigue and negative psychological states. They actually enhanced positive psychological states and improved quality of life. And they actually recommend that all programs for cancer rehab involve MBSR programming. Next slide. So integrative medicine is great. Oncology, primary care, and a lot of primary care is lifestyle medicine. This can all make a huge impact on how survivors feel and also on their outcomes and risks of cancer going forward. As Dr. Cookie said, sleep is so important. 7 to 9 hours a night is the goal for everyone, though we may not get it. Eating a healthy and varied diet, and of course, trying to be more active, move more, and sit less. Stopping any of those habits that can, worsen the outlook for cancer risk, and then implementing all these coping strategies and stress management efforts. Finally, fostering and maintaining a support system in those relationships is very important. Next slide. So I just want to highlight again, lifestyle medicine. This is the wheel that's always advertised. Eat plants, keep moving, sleep well, be present, stay calm, and love people. It's important for everyone. And I would argue even more so for cancer survivors, because a lot of these things can actually improve the outcomes and ability to survive and thrive after cancer. Next slide. So, as Dr. Kofi said, medications can be implemented. And as a clinician, this is something I think about. Low-dose antidepressants can be helpful. There are a couple of real nice and gentle ones that sometimes if patients are going through particularly stressful times that I will recommend. Also, paying attention to supplementation. Vitamin D, fish oil, or herbal supplements like ashwagandha and St. John's wort are things you can talk to your doctor or a naturopath about. Occasionally, anti-anxiety meds or meds to help with focus can be helpful, but these are things we don't like to widely prescribe to patients. Anything more advanced than that, we send patients on to see a specialized mental health care provider. But all cancer survivors should regularly follow with a primary care provider for care continuity. Next slide. And I did have one just more mention. This isn't the updated slide, but harkening back to Dr. Kofi's point that a multidisciplinary team is really the best approach and can provide the best care for survivors, and that including survivorship, palliative care, psychology, social work, and integrative medicine doctors. I myself am a preventive medicine boarded physicians. So it really takes a large team with a lot of different perspectives and input to help them the best. But currently in our health system, we are starting to implement more distress screening into continuity visits for survivors. So in our own survivorship clinic, a large national organization has put together a distress screening that is actually a checklist that our nurses are going to start asking all of our patients. Also, a plug for IDPH with the program that they're offering our funding opportunity to expand psychosocial programming across Illinois that I hope to be working on soon. And then growth of our partnerships and engaging community organizations with healthcare systems so that we can bring all of these things to all of our survivors. Next slide. And I'll just finish just saying that there's a lot of mental health issues that can rise during cancer. Survivorship is highly, highly emotional for patients to go through and can be tricky for physicians to handle as well and to help to guide. There are lots of different strategies and resources that exist to help with survivors' well-being. So go on and offer support to anyone that you know that may be going through this or close to someone who is. Next slide is just my email. So if any of you want to jot it down, feel free to send me questions anytime.
Thank you so much, Dr. Manst. You feel free to put in any questions in the chat. I did have a question of my own that I was hoping you could talk about a little bit. As a provider who works, directly in this space, I know one of the things that can cause a lot of anxiety for patients is when they may complete their therapy for their initial cancer, and then there's that bridge where they have to move from their oncologist sort of back into a primary care space. I wonder if you could talk a little bit about how to best care for patients as they make that transition, or what resources may be available, particularly people who may not have access to a survivorship clinic.
Right. Yeah, and that's one of the benefits of the program that we have. But in a lot of cases, they are being shifted back over to primary care, so oncologists are able to provide their specialized care to patients recently diagnosed with cancer. So again, continuing to have that primary care physician involved throughout since the time of diagnosis throughout survivorship is important. So it's not so much a transition as just like a rebalancing, right? So these are all things that primary care should be starting to get in tune with. We're trying to enhance provider education for how to build all of these different skills and give support to cancer survivors. So seeking out opportunities to learn more about survivorship from primary care providers would be something that I encourage. And I encourage patients to advocate for themselves. You know, if they aren't liking something their primary care doctor saying, well, seek a second opinion. Don't be afraid. Ask your doctor why this is. And if you don't agree or feel like you jive with them, you can find another doctor. Um, so I can't tell you how many patients I said you need to fire your PCP. Um, it's something that survivors, you know, have trouble a lot of times finding their voice with, but really speaking up for themselves is key.
Well, thank you so much for those words and for your presentation. I'm actually going to shift the moderator duties over to my co-chair, Dr. Neil Perlman.
Thank you, Keith. Thank you, Dr. Manst. I would like to introduce Phil Talley. Phil is an esophageal cancer survivor and an advocate for cancer-related issues. He's going to share his cancer journey and mental health issues. Phil?
Good afternoon. Can you hear me?
Yes.
I would like to thank IDPH and the Illinois Cancer Partnership for having the honor of presenting with this distinguished panel. Before I begin, I would just like to state that I am not a medical professional, nor do I claim to be an expert on mental and behavioral health issues. I'm simply here to provide perspective as a cancer patient and survivor. I would also like to acknowledge that every cancer patient's experience is unique and different. Some similarities, but every perspective is different. Individually speak for all. In my own experience as a cancer patient, I did struggle with anxiety, depression, insomnia, and then survivor's guilt. I'm not here seeking sympathy. My hope is by sharing my experiences, I can help promote awareness of these issues and perhaps give some comfort to those who are struggling with similar challenges. Next slide, please. On September 30th, 2015, I was diagnosed with esophageal cancer. I was 49 years old. My wife and I had just become empty nesters. Our daughter was a senior in college at ISU in Bloomington, and our son had just started his first year at Monmouth College, where he was playing football. We were all pretty excited about that and looking forward to the next 4 years. Prior to my diagnosis, I knew very little about esophageal cancer. I received the bad news after undergoing a colonoscopy and an endoscope. As I was laying in recovery, coming out of the fog of anesthesia, my GI doctor told me that he had found a tumor in my esophagus. He referred me to an oncologist and told me to see the oncologist as quickly as possible. Strangely enough, I didn't feel scared after hearing that. I actually felt relieved because prior to the procedure, I was afraid that I had colon cancer or stomach cancer. So when the doctor said that I had esophageal cancer, I thought it was no big deal. At that point, I was in denial and I wasn't the least bit scared. Next slide, please. But when I got home, I started playing Dr. Google. I did a Google search on esophageal cancer, and the first thing that I read was that the overall 5-year survival rate is less than 20%. Less than 20%. How can that be? That can't possibly be right, I thought. It's just an esophagus. It's not a major organ. So I checked another website and I saw the same grim statistic, but I still didn't believe it. So I went to another and another, and they all said the same thing. That's when the reality of what I was facing finally hit me, and it hit me hard. As I was staring at my computer in disbelief, I became aware that my wife was silently standing behind me and reading over my shoulder. I looked up at her and I said, "Why now? I don't want to die now." We both broke down crying. Next slide, please. The possibility of not being there for my family made me scared, sad, and angry. My children were just entering adulthood and I had so many important milestones coming up. And I was afraid that I would not be there for any of them. Would I be there for my daughter's upcoming college graduation? Would I be there for her wedding? Now, she didn't even have a boyfriend at the time, but that's still one of the first things that crossed my mind. Would I be there to walk my daughter down the aisle and to have that special father-daughter dance? Would I get to see my son play college football? He worked so hard to earn that. Would I live long enough to see him graduate? Would I live to see him get married? Would I live long enough to see my grandchildren? All I could think about was all the good things we had coming up on the horizon, and that I might not be there for any of them. I went from being in denial and feeling invincible to being overwhelmed with anxiety, sadness, and anger. After I pulled myself together, I asked my wife to please not tell anyone about my diagnosis, not even our children. I wanted to wait until we had met with the oncologist, completed all the diagnostic tests, and knew my prognosis and the plans for treatment. I didn't want to scare my family like I had just scared myself. And I didn't want them to ask me a bunch of questions that I didn't have the answers to yet. So we chose to wait before telling anyone. Next slide, please. The next few weeks seemed like an eternity. I underwent a CAT scan, MRI, and PET scan. The good news is I was stage 3. My cancer had not yet spread outside of my esophagus. If it had, I probably wouldn't be here today. I was very lucky that we caught it when we did. My treatment regimen would include 6 weeks of radiation and chemo treatments, followed by an esophagectomy. The road ahead would be extremely difficult, but there was hope. Now that we knew this, I was ready to tell others. Next slide, please. Cancer has a unique way of scaring the hell out of you and then making you realize just how blessed you are. One of the common things that I frequently hear from other cancer patients and survivors is that it brings out a greater sense of gratitude. And that was certainly my experience. When my family and friends heard that I had cancer, the outpouring of love and support was overwhelming and very humbling. People were constantly bringing us food, which is very kind, but kind of ironic because I couldn't really eat. But my wife ate very well, and our freezer got to be well stocked. We were also beneficiaries of so many unsolicited favors. Friends and neighbors cutting our grass, raking our leaves, shoveling our snow. We never once asked anyone to do any of those things. We didn't have to. People just showed up. All these things reminded me of how truly blessed I have been with so many good people in my life. And that outpouring of love and support inspired me to endure through the pain, nausea, and fatigue brought on by radiation and chemo treatments. I was also very lucky because my employer, Illinois Public Health Association, was extremely supportive, accommodating, and compassionate. They treated me very kindly. Sadly, that's not the case for many cancer patients. Some lose their jobs while fighting for their lives. Financial devastation compounds the sense of hopelessness and despair for far too many cancer patients. Next slide, please. For me, the emotional and mental health challenges grew much worse after my esophagectomy. For those that are not familiar, an esophagectomy is a major surgery which requires a large incision in your abdomen and another large incision in the side of your neck. The surgeon removes most of your esophagus and then pulls your stomach up through the chest cavity and reconnects the stomach to the remaining portion of the esophagus at the base of the neck. The result is the stomach, or stomophagus, as some folks call it, is now a long tube that runs through the chest. Next slide, please. As to be expected, I felt a lot of anxiety leading up to the surgery, but I tried not to let it show. And I didn't say much about it because I did not want to make my family worry. So I kept my fears inside, as many people tend to do. One of the risks of an esophagectomy is potential for leakage. Unfortunately, this did happen to me, so my surgeon had to reopen that incision in my neck and fix the leak. Once the incision was reopened, it could not be sutured closed again. It was left to close on its own and treated with a wet to dry dressing. So I had about a 4-inch open incision in my neck. It looked disgusting. I spent nearly a month in the hospital, and that incision was still not closed when I was discharged. It took about 2 months for it to close completely. The other problem that I experienced was I had extreme gastroparesis after the surgery. So my stomach was not emptying. Therefore, I could not eat and had to remain on a feeding tube for 7 months. 7 long, miserable months. I hated having that thing hanging out of my side. And I hated the restrictions it put on my life. I was attached to the feeding pump for 12 hours per day, generally from 6 in the evening to 6 in the morning, every day. I felt like a dog on a chain. I truly hated it. I wanted my old life back. I wanted to go out and do things again. I wanted to enjoy life. I wanted to truly live, not just exist. That is when my anxiety and depression grew worse. There were times that I would start crying for no apparent reason, and this always made me feel embarrassed and ashamed. I felt like I was being ungrateful. I would remind myself of how lucky I am to be alive, and that so many other cancer patients were not as fortunate. I told myself that I had no right to be depressed, and that I just needed to snap out of it, quit feeling sorry for myself, quit being weak, quit being ungrateful. To make matters worse, I frequently suffered from insomnia. So I'd lay there at night, alone in the dark, with nothing to do but worry about whether or not things would ever get better. This was the constant dialogue that was going on in my head, but I wouldn't talk to anyone about it, except for my wife on rare occasions, only because she could see that I was depressed, and when she would try to talk to me about it. But I would generally change the subject. I never thought of harming myself. I was not at risk of suicide, but there were times when I asked myself why I even bothered to go through it if this is how my life is going to be. I had gotten dangerously close to losing hope. It's important to emphasize that I was too ashamed and embarrassed to seek help for the anxiety and depression that I was struggling with, or even admit that it was a problem. On the contrary, I always tried to be strong for my family and friends. I tried my best to remain upbeat and positive around others. Most of my friends and family didn't even know that I was going through this. I struggled in silence for months. Next slide, please. On September 9th, 2016, 7 long months after my esophagectomy, and nearly a full year after my initial diagnosis, the feeding tube was finally removed. It was one of the happiest days of my life. For the first time in a year, it felt like things were finally going to get better. Next slide, please. Over the course of the last 8 years, I have lost friends, colleagues, and even a couple of family members to various types of cancer. Each time that happens, I ask myself why. Why was my life spared, but their lives were taken? Survivor guilt is something, excuse me, that I struggle with every time I hear about someone dying from cancer, especially a family member or close friend. I'll never be able to answer that why question. As a survivor, all I can do is use my experience to help others. And that's why I'm sharing my experience with you today. Next slide, please. I would like to end with a message of hope for anyone who has recently been diagnosed with cancer, anyone who's in the midst of the fight, anyone on the brink of losing hope. I want to let you know that I was there for all those precious moments that I thought I was going to miss. I was there for my daughter's graduation. My son played 4 years of college football and I only missed one game. I was there to see him graduate. Now he's a teacher and a coach. My daughter got married to a great young man in 2019. I was there to walk her down the aisle. And I was there for that father-daughter dance. And I'm not ashamed to say, as you can see in the picture there, that I cried like a baby. And speaking of babies, I have an adorable granddaughter now and another one on the way. My son also got married this past summer to a smart and beautiful young lady that we are happy to welcome to our family. I am so glad that I never gave up hope. But while I'm grateful to have celebrated all these special moments with my family, I am ever mindful of those who are not as fortunate. And I respectfully honor all those who fought the good fight but are no longer with us. Thanks for listening.
Phil, thank you for telling your story. I'm also a cancer survivor, and some of the things you went through, it was a slight flashback to my journey also. So I greatly appreciate, you opening up and telling what you went through. It is something that many patients go through, and unfortunately, a lot of doctors, don't realize the full extent of, what we go through. Our next speaker I'd like to introduce is Jackie Harrigut. Jackie is the Director of Partnerships and Engagements for Imerman Angels. Like me, Jackie comes from a cancer family. She has been the caregiver to multiple family members. While some are doing well, others have succumbed to their battle with cancer, and this has fueled her passion for Imerman Angels. While many of you have probably not heard of Imerman Angels, it is an excellent organization that helps newly diagnosed cancer patients with their emotional stress. As Director of Partnerships and Engagement, she oversees the Mentor Angel training process, community events, and the organization's outreach and engagement efforts. Additionally, she established the Global Ambassador Initiative, comprised of volunteers who dedicated their time to spread awareness about the Imerman Angels mission. Her professional goals aim to continue fostering a strong and diverse cancer community, strengthening partnerships with cancer organizations, cancer centers, and hospitals to expand the reach of Imerman Angels' mission. It is my pleasure to introduce Jackie.
Thank you so much. And my goodness, Philip, I'm kind of trying to catch my my voice. So congratulations to you, and thank you again for sharing that story. And I want to thank the coordinator that allowed me to follow up after these amazing speakers. Yikes. Okay. But seriously, thank you for this opportunity for me to be here. I did want to share my slides, so let me just do that real quick. And if I can thumbs up to know that you guys can see it, that would be awesome, or a something so I know it's there.
We can say it,
cool.
thanks.
Thank you. Appreciate that. So I have a confession to make. I just came back from speaking at the NCCN conference. It was all about navigating the care continuum for anywhere from screening to survivorship. And it was in Washington, D.C. And I was so excited because I had never been there before. So before I went, I actually asked a friend what restaurant I should go to. And she told me to go to this Old Abbott Grill. And I was like, awesome. Thank you so much for telling me that. But how do we get there? Is it expensive? What do I wear? What do I order? And tell me about the dessert. Okay, I swear I'm not here just to talk about restaurants. I'm actually here to make a point. You see, we do this frequently where we ask people who have been there. You ask people what they know about the unknown. You might do it to feel more excited, in this case, maybe to feel less afraid, but definitely to gain some knowledge, to feel a little bit more empowered. So, of course, if somebody is going through a cancer diagnosis, they're going to want to talk to somebody who's been there. They're going to want to ask them questions because things are going to come flooding to their brain. Like, what chemo going to when it hits my veins? Will I be able to date after cancer? Will I be able to go to my daughter's wedding? How do I get rid of this yucky metallic taste caused from chemo? Or if you're taking care of a loved one, you'll have questions like, how do I work and get my loved one to all their treatments? How do I normalize this cancer experience for my little ones, but also make sure my loved one is okay? What if my loved one doesn't make it through this cancer diagnosis? Now that my loved one hasn't made it through cancer, how can I possibly even think about moving on with my life? I have this genetic mutation. I have no idea what it means or what to do. So these people are going through this cancer experience, feeling isolated and alone. And that just makes no sense because there's a solution and it's absolutely free. You see, it's called Immerman Angels. Immerman Angels provides personalized connections from people who have been there for all cancer fighters, survivors, previvors, and caregivers. You see, we envision a world where cancer is not a solitary experience. Now I know you're like, who the heck is this chick telling us about the importance and magic of peer-to-peer support? My name is Jackie Harrigot, and I'm the Director of Partnerships and Engagement, and I have been with Immerman Angels since 2012. I came to Immerman Angels a lot more experience than I really wanted to have. I had already lost my grandmother, my mother, and my aunt all to cancer. I knew that I didn't have the money to fund a cure. I knew I didn't have the brain to find a cure, but I absolutely was certain that I had the empathy, experience, and heart to build connections. And I knew that I needed a way to turn my pain into power. And Immerman Angels allowed me to do just that. I became what's called a mentor angel. A mentor angel is a volunteer cancer confidant, a light in a dark room, someone that has gone through the cancer experience to share tips and tricks. Example, have a box of lemon heads. It actually helps you get rid of the yucky metallic taste caused from chemo. Now, do we train our mentors? Absolutely. We always do tell them that the bulk of their training is their own experience. We can't train them on that. But we do provide them with a Mentor Angel guidebook where they can go through the do's and don'ts, and they also get an interactive video. In the video, there's some interactive quizzes, and it shows them kind of through the process. And anyhow, at the end of that, they get certified. They go ahead and print out that certificate, frame it, and put it over their fireplace. Now, I know that sounds kind of funny, but it's true. You see, we know, we've heard time and time again that cancer turns people into victims often. They feel that, but they also tell us that Immerman Angels allows them to feel like heroes. Over 17 years ago, Johnny Immerman started the organization out of his own 2-time testicular cancer experience. While he always had a room full of people that adored and supported him and told him it was going to be okay, something was missing. None of them had been in his shoes. So it's like if somebody tells you, go to this restaurant, it's awesome, you're going to love it, it's not expensive, this is how you get there, this is what you wear, oh, and this is what you order, and definitely have the dessert. You're like, oh, wow, thank you for all this advice. So when's the last time you were there? And they're like, never. The advice is just malleable, appreciated, but definitely not as valuable. 85% of the people that do come our way say that they feel less isolated and alone after they get connected. And I know that to be true because for me, as you heard, caregiver, 2019, my sister got diagnosed with stage 4 breast. And it was one of the most terrifying times in my life. One of the most important things to her at first was that she got to keep her hair. She has an autistic child, and if y'all know anything about autism, you have to very much stay in a routine, and her being bald would definitely be outside the routine. So her concern was to keep all her hair. So I was like, all right, I'm going to help you with this cold capping therapy that allows you to keep your hair. Never did it before. So I turned to one of our caregiver mentors who had that experience. She told me everything that I needed to do, even the stuff to order, from the infrared thermometers to the dry ice to the knee pads to protect my knees. She told me, your knees are going to bruise because you need to be on that ground, pushing that gel thoroughly through that cap all around your sister's hairline because you don't want to miss any spots. And the good news is that we actually did it. We were successful in keeping my sister's hair. But what's even more amazing is at this point, my sister, she shows no evidence of disease and a complete response to treatment. So it's so exciting to be in this situation, but I wish I could tell you that the story ends there. In 2020, I got diagnosed with skin cancer. So the one good thing is that I knew where to turn. I didn't have to think about it. I knew that there was going to be a mentor there for me, right, who had gone through the same treatments that I was about to go through. Now, I'm not saying through any of these experiences that I wasn't still scared, but what I am saying is I was way more prepared, and I knew I wasn't alone. Now, we are providing these amazing emotional connections around the world. You see, we're in over 114 countries. We have made over 36,000 matches. And we're helping for so many cancer types, over 146. And I know this sounds like a lot. Over 14 mentor angels have been recruited and trained. And it is a good number, I'm not going to lie. You all know this better than me. Every day, There's a new cancer diagnosis. We just heard every 30 seconds, right? We'll multiply that by the caregivers and the previvors, right? So we always need more mentors. So if you yourself have a cancer experience or are a previvor or a caregiver, please consider becoming a mentor angel with us. We would love to have you. 97% of the people that have been connected with us, they say that they would recommend Emmerman Angels. I think that's pretty good. I don't think any of you would recommend a bad restaurant, would you? These are some of our peer-to-peer partners. They turn to us and ask us their peer-to-peer matching as well, because they agree, right? And we're coming together to form this amazing resource like a village, because y'all know it takes a village to get these people through this cancer experience. So we have to collaborate and we have to join together to give them our best. This is the easiest way to do that. You're going to send people to our website. And I see my number 2 is missing and I have no idea why, but I'm going to tell you what it says. It is to register and get assessed. Once they do that, we find the mentor angel for them and we make that introduction and they connect from there. Now, I may not know all your names, but I know this fact is true. You all are here to make the lives of those people going through this awful cancer just a little bit better, right? So I'm asking you to click on that QR code, take down that website, that email, that phone number, I don't care, but get a hold of us and send people our way and make sure that you're implementing peer-to-peer as your standard of care and making sure they're getting the psychosocial support that they need and that they are not at all going through cancer alone. Thank you so much.
Jackie, thank you for your excellent presentation. I just want to do a quick check to see if there's any questions for anybody.
I just want to say thank you so much, Jackie, Dr. Kufi, and Phil. Oh my God, that story had me in tears too. This is all awesome. I am a mentor angel, yeah, just this has been a wonderful series of talks. Thank you, everyone.
We do have one question, if there's Spanish-speaking angels.
Yes, and we have Spanish-speaking support specialists, which are the people that do the phone calls to train people and to find out their needs. So yes, and we have other languages as well for mentor angels.
Again, thank you. It looks like that is all the questions we have for today, and I'd like to thank everybody that presented for their different takes on the psychological aspect of cancer care. You know, having hope for the care is extremely important, besides the surgeries and the chemotherapies and the immunotherapies. It's extremely important, and it is something that we all go through, and we have to be aware of it during the treatment. Keith, do you have any final thoughts?
I'd just like to second you on thanking our wonderful speakers. And you know, as a healthcare provider, you know, I certainly learn every time I hear, you know, particularly the individual expression of people's experiences, to help all of us be more mindful of these things as we ourselves go through our lives and as we help others as well. I did want to give an opportunity to Linda to mention the post-webinar survey, if you would like to introduce that as well.
Sure. So when you leave this webinar today, you'll be directed to a post-webinar survey. It's a very short survey, shouldn't take you more than 2 to 3 minutes to complete. Your feedback input on this webinar is very important for the planning in the program. And then I do also have a note for some future cancer and webinars that we're in the midst of planning. So you'll see that registration come out soon. I do have a question for Jackie. Are you able to match up maybe like parents who have children with cancer?
Yes. Yeah.
Okay,
We sometimes
Great.
can match the children too. I don't want to overpromise, being completely transparent. We do have a lot of children that come our way, and then we match them with someone, example, like a 8-year-old we had last week, who had a neuroblastoma. We were able to match somebody that was, I think she was 12, but was 8 when she was diagnosed, so that she could talk about, like, reflect back. Yes, I was 8 when I was diagnosed, but this is where I am now, to again provide that inspiration and hope and the fact that she could move forward.
And Linda, I want to offer, this is Dr. Manst at UIC. We have a clinical trial going on right now with the survivorship program at UIC. Get in touch with us. It's for parents with advanced stage 4 cancers and enhancing the communication between them and their children. So it's the other side of that picture. So lots of resources everywhere.
Okay, great. And your email, we put it in the chat.
Yeah, Manst at uic.edu. MANST.
Okay, great. So thank you to all our speakers, and thank you again to Phil for sharing your experience. I think it probably moved every one of us, and it was so timely with the presentations to show how important, the mental health support is during the entire journey. Okay, and I don't see any other questions or comments. So thank you very much for everyone attending, and we'll be sure to send out the recording link. If you do need to refer back to any of those slides, you'll have the recording.
Thank you so much, Linda, for putting this together.
Thank you.
Thank you.
Thank you, everyone.
Thank
well.
you, everybody.